Hello, I'm Dr. Bernet. I'm a child psychiatrist and a forensic psychiatrist in Nashville, Tennessee. So the webinar that we're doing today is called Parental Alienation Relational Problem and DSM-5 TR. So I gave a webinar on this topic a few months ago, having to do with this proposal that we're submitting to the American Psychiatric Association. But what I want to do today, I'm going to summarize the proposal, but what I want to do is to give an update regarding the different steps that have happened since I gave the initial webinar on this topic a few months ago. So first of all, here, take a look at the picture. This is a picture of the book that we're talking about, DSM-5 TR. TR stands for text revision. So what we're talking about is this diagnosis, which we call PARP, P-A-R-P, that stands for Parental Alienation Relational Problem. And then the DSM is called the Diagnostic and Statistical Manual of Mental Disorder, 5th edition text revision. So just to kind of summarize, in the next slide, we reiterate something that we've said many times, that we realize that the words parental alienation are not in the DSM, but the concept of parental alienation is in the DSM. So that's been the case ever since DSM-5 was published, which was in 2013. And then that continued to be the case when the next revision, it's called the DSM-5 Text Revision, TR, was published in 2022. That the concept of parental alienation relational problem, or the concept of PARP, it has been mentioned in 3 different places. So let's review those together. There are 3 different conditions that illustrate what happens in PARP. There's child affected by parental relationship distress. And the actual definition of that mental condition in the DSM is negative effects of parental relationship discord, such as high levels of conflict, distress, or disparagement on a child in the family. So that might sound familiar to you because that is a paraphrase. The definition of CAPRD in the DSM-5 is a paraphrase of the definition of parental alienation. That is, a child is affected by discord between the parents. So there's another diagnosis in the DSM-5, which is parent-child relational problem. And the definition of that condition includes negative attributions of the other's intentions. In other words, they're talking about the child and the parent, their intention, the negative attributions about each other, hostility toward the other, and unwarranted feelings of estrangement. So that also sounds familiar because that's also a paraphrase of what happens in parental alienation. And finally, there's a new diagnosis in the DSM, in the DSM-5, which is child psychological abuse. And the definition of that condition includes harming or abandoning people or things the child cares about. So there are several conditions that are already in the DSM that convey what happens in parental alienation, even though the actual words parental alienation or parental alienation relational problem are not in the DSM-5. So incidentally, it's clear that if an evaluator is seeing a family and makes the diagnosis or identifies PARP, that there are already 3 different diagnoses that can be used depending on the focus of the evaluation. In other words, if the focus of the evaluation is on the child and the child's mental state, then the evaluator can use the diagnosis CAPRD, child affected by parental relationship distress. But if the focus of the evaluation is on the relationship between the child and the affected parent, the rejected parent, then the diagnosis that can be used is parent-child relational problem. Or finally, if the focus of the evaluation is on the alienating behaviors manifested by the preferred favored parent or the alienating parent, then the diagnosis could be child psychological abuse. So there's already a good deal of information in the DSM that relates to parental alienation. But what we want to do is now get the actual definition, the actual words parental alienation relational problem, and the definition in the DSM-5. So here, this is what we have. Let's go through the proposed definition of PARP. Let's read this together. This category may be used when a child, usually one whose parents are engaged in a high conflict separation or divorce, allies strongly with one parent and rejects a relationship with the other parent without a good reason. So that's the first half of the definition that we're proposing. And this is a very common definition. It's been in use for about 10 years. And almost everybody would agree that this is a good generic definition of parental alienation. In our proposal, however, the second half of the definition is the following. And let's read this one together. The diagnosis of PARP usually requires 5 criteria. The child avoids, resists, or refuses a relationship with a parent. The presence of a prior positive relationship with the child and the now rejected parent. The absence of abuse or neglect or seriously deficient parenting on the part of the now rejected parent. The fourth one is multiple alienating behaviors by the favored parent. And the fifth of these 5 criteria is behavioral signs of alienation in the child. In the proposal that we're submitting to the American Psychiatric Association, we give that general definition and then the 5 criteria. And you can see in the next slide that these 5 criteria have been published. This is called the 5 criteria are called the 5-factor model for the diagnosis of parental alienation. And there's an article about the 5-factor model last year in the Journal of the American Academy of Child and Adolescent Psychiatry. So that's a significant event. That journal is a peer-reviewed journal. It's the most widely read journal for child psychiatrists in the entire world. So that's the basic information. That's the basic information of our proposal for PARP to be in the DSM-5 TR. But let's take a look at this. Why are we doing this? Why are we going to all this trouble? Why do we think this is important? So that's what I want to tell you about over in the next couple of minutes. Why is this important? So there are 4 big reasons why this is important. First of all, we hope that if PARP is included in the DSM-5, it will mean that it is more readily recognized by mental health professionals, especially when they're doing evaluations or interventions or treatments on children and families. In other words, we really want PARP or parental alienation to be recognized sooner rather than later when it's mild. In other words, it's likely that a therapist who's seeing a child whose parents are separated or divorced will come across cases of parental alienation. And we want them to be able to recognize it. And especially when it's sooner, so that the condition is mild and has not progressed to being moderate or severe in intensity. Also, even prevention. If people know about, if clinicians know about PARP occurring in children whose parents are divorced, that if they know that can happen, they can take steps to prevent it from happening in the people and the families that they are treating. So the second reason why this is important has to do with training activities for mental health and also legal professionals. In other words, psychologists and psychiatrists and nurse practitioners and social workers who are being trained or who are studying family issues and the effects of divorce on children will be educated as part of their curriculum about parental alienation relational problem. At least that's more likely to happen if PARP is in the DSM-5. And it's not just mental health, but also legal professionals, attorneys, or students who are in law school will be educated about this topic. So the third reason why we're pushing for this, why we think it's a good idea, has to do with research. That for research to be more effective, we have to all be using the same terminology and the same definitions. And in particular, if we're conducting a research project, we need to use the same definition for parental alienation. And so that one research project, can be compared to another. So that's important. And finally, the topic of parental alienation comes up in court quite a bit. And if there's a standardized definition, and if it's in the DSM, there'll be less arguing about that topic in court. In other words, sometimes when the topic of parental alienation comes up, the two different sides argue about whether or not it really exists or whether or not it matters and so on. And there'll be less arguing if parental alienation is in the DSM-5. Now, of course, it still has to be discussed. I mean, if it's being brought up, the different attorneys would still have to prove it by using the 5-factor model. Just to comment, the 5-factor model is really important because it makes it obvious that you have to have all 5 factors in order to make the diagnosis. For instance, you can't just have a child who doesn't want to see a parent. You can't, if you have a child who's manifesting contact refusal, that all by itself does not constitute a diagnosis of parental alienation. You have to have these other 5 factors in order to make a case. And another thing, just to clarify, the 5-factor model is not a new creation. That all 5 factors have been discussed for years. But what we did, and this is Dr. Amy Baker and myself, what we did is we pulled those 5 things together in order to make one composite so that it would be easier to use in conducting an evaluation. So I've been talking about why this is important, but let me explain what I'm going to be telling you today. I'm going to tell you the arguments that we use in our proposal to support the addition of PARP. And there are 4 main arguments. These are the things that you have to show if you're making a proposal for the DSM. So first, I'm going to give you some clinical vignettes. In other words, to make a proposal, you have to kind of illustrate what is this condition? What is this condition like? What happens in the condition that you're proposing? Secondly, we have to talk about clinical utility. That means we have to be able to show that this new diagnosis would be useful in a clinical setting, like when people conduct evaluations or people do interventions or counseling or therapy, that this name, this new condition, PARP, would be helpful in that setting. The third thing that the DSM asks for is information about research regarding the validity and reliability of the concept of PARP. And I'm going to give you several examples of research studies that we can use for that purpose. And finally, is an interesting thing that you have to be able to show. You have to be able to show that PARP can be distinguished from other mental conditions. And, I already said that PARP is somewhat similar to CAPRD, child affected by parental relationship distress, parent-child relational problem, and child psychological abuse. There are certainly some overlaps between PARP and those conditions. but we need to be able to show how in practice PARP can be distinguished from those and also from other mental conditions. So we've been promoting this for several months, and this is a picture of the website. We have a dedicated website for this purpose, and I'm telling you this so that if you want more detailed information, you can go to the website and you can actually download the actual proposal that was submitted to the American Psychiatric Association. And you can also download various appendices that go with the proposal. So this is what the website looks like. You can find it at www.parp-dsm.info. And this next picture is what the actual proposal looks like. In other words, we've been talking about this for months, but if you want to see what it actually, what page one, the first page of it actually looks like, the heading, the title is Proposal for Parental Alienation Relational Problem to be included in, quote, other conditions that may be a focus of clinical attention, unquote, in DSM-5 TR. So that where I have it in the quotes, other conditions that may be a focus of clinical attention, that's the name of the chapter. DSM has 25 or 30 chapters, and there's one chapter that's called Other Conditions. So in our case, we're proposing that PARP be considered a relational problem, and relational problems are in this chapter called Other Conditions. For instance, all three things that I mentioned before are in that chapter: CAPRD, the child affected by parental relationship distress, parent-child relational problem, and child psychological abuse. All those conditions are already in the chapter called Other Conditions. And as you can see, the authors of the proposal are myself and Amy Baker, psychologist in New York, and we're doing this on behalf of our organization, the Parental Alienation Study Group. So let's look at some vignettes. I mentioned that when people talk about a medical condition or a psychiatric condition, it's common to present a little vignette so that the person, the listener, understands what we're talking about and has a clear picture of what this condition is like. So I have a few vignettes, but I'm doing this a little differently than what usually happens. Usually when people give vignettes, it's a little narrative, like it's a little story, or it's a physical description of the person if it's a medical vignette. If it's a psychological vignette, it's usually a little narrative about what happens, what the person is experiencing, and so on. But what I have found, in order to illustrate what happens in alienation, I think it's better to use these drawings. My colleagues and I have been collecting these drawings now for several years, and thanks very much to the people who have sent them in to us. And I use them to illustrate what is the mental state of a child who has parental alienation, or especially as you can see, these are more severe cases of parental alienation. So some of these are pretty sad. I got to give you a little heads up, a little bit of a warning that they're a little bit grim. So please take a look at this first one, which is a case of severe parental alienation in a 9-year-old girl. You can see it's a very unhappy drawing that she made of herself. And the picture has all sorts of scars and cuts and bruises. And she says, "I hate my life," and so on. If I realize this is a little bit sad, but if you were doing an evaluation and a child were to draw a picture like this, I mean, you would know that there is something going on with this child. This is a very disturbing self-portrait of a child. Here's another self-portrait by an older child who's a 17-year-old high school student. And it's also a picture of severe alienation. But you can see this is a pretty nice picture. of herself, I think. And she has some talent in art. It's a good picture. But what I'm going to do, though, in the next slide, I'm going to show you a close-up of her eyes. So here, take a look at this. And if you look closely, you can see that her eyes have the words, "Help me," on the retina, or not the retina, but the surface, the cornea of the eyes. So that's pretty striking. This was publicly displayed. This picture was displayed in an art show in a high school. Now, I got to say that these pictures are pretty dramatic, but obviously these pictures all by themselves do not constitute parental alienation. In other words, if you're conducting an evaluation, you don't make a conclusion about a diagnosis simply on the basis of pictures, even pictures like this. You know, you have to do a whole evaluation, collect information, interview people, and do certain kinds of testing. Well, here in the next slide is another, this is what I would call a before and after sequence of a child, a little girl who became alienated. So this is before, when she had a good relationship with her father. And she says, "Dear Dad, there is only one person in the world to be my daddy, and that is you." And it's kind of cute. She writes in here, drum roll, before she says love and so on. So that's a very, very nice message from this child to her dad. Well, a year or so later, she became severely alienated. And the next picture is also somewhat grim, is a picture of her having murderous thoughts, murderous fantasies about her father. You know, you can see that she's holding a sword that looks bloody, and she's saying, "Unsincerely me," and then on the other side it says, "Head unattached, you with your head unattached." So, I mean, if a person were doing an evaluation and the child comes in with these pictures, I mean, that's an extremely abnormal mental state for a child to have murderous fantasies about a family member. And I have another before and after that actually does the same thing. So this next one starts out with a girl who's 7, and she's drawing a picture, and she has a message on the left-hand side of this page where it says, "I love my mom and dad and my whole family." And on the right-hand side is a picture of her family. You can see that she's there, and then her mom, and then her dad. And actually, you can see it, but in the dark background is her sister. So all 4 of them are in the picture, even though the sister is a little bit in the shadows. So that's a happy picture. The next one is also prior to alienation, and it's also very happy. This is a little, I guess it looks like a Valentine message that says, "To Daddy from so-and-so, I love you." So these are very common. I mean, little kids draw these Valentine messages sometimes at school, and they bring them home. So that's obviously a normal message. But sadly, after that, as things developed, this little girl became severely alienated from her father. And she kept a notebook. And in the notebook, she wrote the following story, which you can read together with me. This story is called He and She and the Kids. She had the kids. She gave the kids to him. The kids didn't want to go. He gave the kids back. She had the kids. She gave the kids to he. The next day, he took the kids. He got shot by a tank. The kids lived happily ever after with she, and then it says the end. So this is a very disturbing story. This is also like the previous story. This has murderous fantasies by a little girl about her father. She also drew some pictures. And in the next slide are some pictures that she did. which involve fantasies of her dad's violent death. And you can see it says army people to attack. And then on the next slide is a close-up. And there's an army personnel carrier, a truck carrying soldiers. And there's the tank. In the story, she said he got shot by a tank. And here's the tank in the drawing that she did on the next page. So I'm using these drawings to illustrate the mental state of alienated children. And in this case, these are severely alienated children. And I want to mention that sometimes parental alienation can be so severe that it is lethal, it is fatal. And my colleagues and I are also collecting some accounts of these tragic cases. And first of all, there are tragic cases in which someone involved in parental alienation has committed suicide. On a few cases, it was the child. This is very disturbing, the idea that a child who's alienated from a parent and caught in this battleground might kill himself. Sometimes it's the targeted parent, because it's so frustrating to be a targeted parent that they lose hope. And sometimes it's the alienating parent who commits suicide. And in some tragic cases, murder occurs. For instance, there have been a few cases where the alienated child killed or helped to kill the targeted parent, the rejected parent, or what has happened more often, the alienating parent kills the children and also then kills themselves. And both moms and dads have done this. So I want to suggest, please, if you have thoughts like this, if you're feeling very, very frustrated or very hopeless, please don't just let it fester. Please be in touch, contact a helpful person, contact a support network, or whoever you can to help you get through a rough time. So in our proposal, we do give these vignettes in order to illustrate how serious is the mental condition of PARP. So the next criterion that the APA wants to talk about is clinical utility. And we discuss that by showing that parental alienation theory has been recognized and addressed all over the world. And you can see in the next slide, these countries. Over the last few years, we've collected references from about 50 countries in which parental alienation has been discussed. And we take that to prove the clinical utility, that if it's so widely understood, that it's a vast help to clinicians to be able to use this kind of terminology and to have it in the DSM so that it's used consistently. Incidentally, these 50 countries are listed here. So we're not just talking here about newspaper articles or magazine articles. We're talking about articles from the professional literature, like a journal article or a book chapter, something like that from these countries. And most of this is descriptive. In other words, there's been a lot of research and a lot of things written about parental alienation. Most of it is descriptive, but some of it is quantitative research. And that's what I want to tell you about now. The next topic is to be able to show that there's an abundant amount of empirical research regarding parental alienation. And that's, we need to be able to show that in order to show the validity and the reliability of this topic. So a good article that hopefully you've already heard about illustrates both the qualitative and quantitative research regarding parental alienation theory. And this article was published just a few months ago in 2022 by Jennifer Harmon and her colleagues. who were Richard Warshak, Demosthenes Lorandos, and Matthew Florian. So they wrote an important article called Developmental Psychology and the Scientific Status of Parental Alienation. So this is particularly important because it was published in a really important journal. It's called the Journal of Developmental Psychology, which is one of the premier journals published by the American Psychological Association. And they did this huge literature search for articles having to do with parental alienation, of which there were more than 1,000, but they narrowed it down to simply articles that have actual data. They wanted articles that actually had quantitative empirical data that could be considered. And they located more than 200 of these. And in the next slide, you can see how they reflect both qualitative and quantitative research. That this goes over a period of years from the 1980s to currently. And what this shows, the bottom part of this diagram is qualitative research, which is descriptive, and the top part is quantitative research, which has statistics and has data. What this graph shows is what typically happens in a new field of study, that initially for several years, there's mainly qualitative or simply descriptive research. And as time goes on, more researchers get interested and they do quantitative research. And that's what happened here. So some of this research pertains to the 4-factor and the 5-factor model. So there are a couple of articles I want you to know about, and these are the articles that we submitted to the DSM-5 people. This idea started with the 4-factor model, and then with a little bit of adjustment, we made it the 5-factor model, which we think is a better tool. But in any case, Dr. Amy Baker published a study several years ago that focused on the validity and reliability of the 4-factor model. And the way you do this kind of research is you create little vignettes, and then you have a number of different practitioners or researchers study the vignettes and to give their opinion as to whether or not they meet the criteria for parental alienation. And so that's what Dr. Baker did in this study. And she was able to show that there was a high degree of reliability across the vignettes. So there's another study more recently about the 5-factor model, where Dr. Stephen Morrison and his colleague did something similar, except they did it with what we now call the 5-factor model. In other words, they took vignettes, they created several vignettes that either did or did not have, they either did or did not meet the criteria for the 5-factor model. And then people would read them and give their opinion. And that they were able to show that these vignettes indicated a high degree of reliability among the various people who read the vignettes. So that's the kind of thing that we can use, the kind of research we can use to show that this condition can be diagnosed in a reliable, consistent manner. But there's also another thing we can do, in that we have tests for parental alienation, which are objective, meaning they can be measured and scored in an objective manner. And I want to tell you about several of these objective tests for alienation. So this is I'm telling you this because this is the kind of thing we put in the proposal for PARP to be included in the DSM-5. So this first research study was also by Dr. Amy Baker and her colleagues. And it was a little test that helps to differentiate alienated from non-alienated children. And they had 2 groups of children. They were all being seen in the same clinic, but some groups were being seen for reunification because they were experiencing alienation. And some of the children were being seen just because of difficulties with their parental divorce, but they were not alienated. And it's a kind of simple test. It's paper pencil. The child fills out a small number of questions, 14 questions regarding the mom and the dad. And these are very simple questions. For instance, do you enjoy spending time with your mother or your father? So that's easy to score. That's either yes or no. So that's scored objectively. Some of the questions are scored more subjectively by the evaluator. For instance, what are some things you don't like about your mom or your dad? So in the next slide are the results of this test, of this research regarding the BAQ, the Baker Alienation Questionnaire. And there's this little grid here that shows that some of the children were in reunification therapy, some were not, some were alienated, some were not. But anyway, the bottom line is in this slide where it says 87% of the cases were correctly classified with this little quiz called the Baker Alienation Questionnaire. So nobody's suggesting that that questionnaire can be used all by itself to diagnose parental alienation, but it could be one part of a comprehensive evaluation. So here's another example of a questionnaire that my colleagues and I used for a similar purpose. It's a different questionnaire. And this was published. I have a little picture here of the two times that this research was published in the journal Forensic Sciences. And we had several groups of participants. In the next slide, you can see that there were, on the far right side, there were alienated children, that some of them were alienated from their mother, some from their father. And then there were three groups of non-alienated children, or these are what in research they're called a control group. In other words, children who take the questionnaire, but who are not considered affected by parental alienation. So this questionnaire has been around for many, many years. In other words, it wasn't developed specifically for this research. It's called the PARQ, the Parental Acceptance Rejection Questionnaire. And it asks 60 questions about mom, and then the same 60 questions about dad. And, you know, some of the questions are positive. For instance, it says, my father says nice things about me. And that's a positive thing, and the child indicates whether that's true or not true. And some of the questions are negative. So, for instance, it says, my father does not really love me. And the child says whether that's true or that's not true. So how did this research turn out? In the next slide, you can see each group of children, how they rated their mother and their father. And what you mainly want to look at is at the right-hand side of the slide, where it says alienated father. And in that case, the opinion of the father was extremely negative, and the opinion of the mother was extremely positive. And then the other group on the right-hand side, it says alienated mother. And in that group, the child's opinion about the mother was extremely negative, and the opinion about the father was extremely positive. So when one parent is perceived in these extreme ways, if one parent is perceived in an extremely positive way and the other one in an extremely negative way, that's called splitting. And normal children do not do that. Normal children, you know, they say mom has good points and weak points. Dad has good points and weak points. The children do not, normal children do not say that that one parent is totally good and the other parent is totally bad. So that was a very dramatic outcome. And in the next slide, you can see that we created a measure which we call the gap. The PARQ gap is the measure. It's the difference between the mother score and the father score. And so, like I said, with the alienated children, where one parent is extremely low score and the other parent has an extremely high score, that's the gap. And in alienated children, that gap is a very high number. And in this chart, the kids on the right-hand side, which are in red, are the alienated children, and they have very, very high PARQ gaps. And there was one child who's red, who's on the left-hand side, which is okay. This is a little girl who was considered severely alienated, but who actually did not have such a high gap. In other words, if you look at all of our subjects together, 99% of them were accurately identified as either severely alienated or not alienated by the use of this fairly simple test. So that's really important to be able to know that it's possible to do that. And even though it's 99% accurate, nobody would try to use that test all by itself to diagnose parental alienation. That's just one part of a bigger evaluation. The research that we did was replicated somewhat in the sense that some people in the United Kingdom did a very similar study using, in a different country, a different group of children and a different test, but with very similar results. Their names were Blagg and Godfrey, and they used a test called the Bernet-Anthony Family Relations Test. And in the Family Relations Test, I don't think I need to describe exactly how it's done, but basically the child conveys either negative or positive opinions about different people in the family. And the next slide is the results of this research. And it's the same as what I showed you previously, but basically that children who were alienated from their father had very negative opinions of their dad and very positive opinions of their mom. And you can say the reverse of children who were alienated from their mother. So it was a very similar result with very significant differences between alienated and non-alienated children. So here, I want to tell you about one more research study. The ones I've told you about so far all involve questionnaires given or tests given to the children. You know, the one by Dr. Baker, the one by me, the one by the people in the UK. They all involve questionnaires or testing administered to the child. So here, this next one was a questionnaire that was administered to parents. And this is by Gina Rowlands, and she developed a scale that she called the Rowlands Parental Alienation Scale. And it basically is a series of questions for parents regarding their children's behaviors. So it's a way to find out about how the children are thinking and perceiving and behaving, but this is done by questioning the parents, not the children. So it's a different way of going after the same information. So she asked the parents about behaviors that are typically seen, or in previous research, are typically seen in alienated children, such as the child manifests a campaign of denigration toward the alienated parent, and this thing called the independent thinker phenomenon, and what we call reflexive support of the favored parent. Dr. Rowlands had almost 600 parents. Some of them had been found to be alienated by a court or by an independent court evaluator, and some of them were not found to be alienated. So she had both alienated and non-alienated parents, all of whom were involved with family court. So what she found was that they scored significantly differently. In other words, parents who were in the alienated group had high scores on this scale, the Rowland's parental alienation scale, and the other people did not. So that's another way, and once again, it's not something you would do all by itself, but it's something that would be part of a bigger evaluation. So I've covered a number of different topics. I've tried to summarize what we submitted to the American Psychiatric Association, but there are some loose ends. And by loose ends, I just want to mention a number of topics that are important that we also submitted to the American Psychiatric Association, but which I have not brought up in this presentation. And just, I'm just trying to convey that the actual application, the proposal, is much more complex than what I can talk about here. So here's some topics that we did submit as part of the proposal. The history of parental alienation theory. So that's important. If people are trying to understand our current proposal, they need to understand how we got here and something about the history of this topic. I have not talked about how we can go about educating mental health and legal professionals. That's something that needs to happen. I and other people have worked on that, but it's not discussed today. And what about treatments? That's something we included in the proposal, the evidence-based treatments for parental alienation and the outcome studies. There have been several studies in which the results of the treatment have been tracked. And so that's an important thing that we submitted as part of the proposal. And finally, this topic is somewhat unusual in the field of psychiatry and psychology because of the amount of misinformation or false information that has been published and otherwise circulated regarding parental alienation theory. So in the proposal, we do summarize this problem and some of the research that's been conducted regarding misinformation, because that's important for the people at the DSM-5 to know that that's part of the picture that they need to take into consideration. As part of this update, I want to tell you what actually happened when you submit something to the DSM-5 review process. So there are a series of steps in the review process, which are listed here. So none of this is secret. In other words, the DSM-5 publishes step by step how they go about reviewing a new proposal. And, there's a fair bit of transparency about how they do this. And there are a number of steps, and it's going to take a long time. It'll probably take about a year to go through all these steps. But as you can see in the next slide, the very first step has occurred. In other words, the first step is submit the proposal to the DSM steering committee. And that happened in November 2022. So we're already 2 or 3 months down the track for this process. And they review it. And the initial review by the steering committee, because of the holidays, that did not occur until a few weeks ago. That occurred in January 2023. So what they do is, if the steering committee, which is kind of the intake process, if the steering committee feels that this is looks like a worthwhile project, and if the proposal, this generally looks adequate, they have it reviewed. They send it to what's called the review committee. That has also already happened a few weeks ago. The review committee are child psychiatrists or other people who have some familiarity with parental alienation. And so they consider the proposal in much greater detail and they try to see whether or not all the different criteria are met and whether or not we have submitted adequate information for them to consider. So let's go down the remaining steps. The next thing that happens is if the review committee doesn't think there's enough information, they send it back to us, and they send it back to the people who made the proposal in the first place to provide additional information if that's what they need. That's where it says perhaps revisions by proposal. So then after that happens, it goes back to both committees, the review committee and the steering committee, to try to decide what to do next. So if both the review committee and the steering committee feel that there's adequate information and that it generally seems to fulfill the criteria for a new diagnosis, they post it for public comment. And that typically occurs for about 30 days. So obviously that has not happened yet, but if this process goes ahead, that will probably happen perhaps in a month or so. So when that happens, the people who are watching this webinar should stay alert and submit your comments to the, there's going to be a portal. There'll be a method, a fairly easy method, so for submitting your comments regarding this proposal. Now, I realize that the people who watch this webinar, you know, many of you agree with this. Many of you agree with this proposal. And hopefully, when it comes time to submit public comments, that you will do that and you'll support the proposal. But, you know, we realize that there are people who don't like this proposal, who don't think that parental alienation relational problem should be in the DSM. And they're watching this webinar also. So, you know, that's okay. You know, this is a transparent process in which we all communicate as openly as we can about what we're doing. So as a result of this, the DSM may get comments from both the people who like the idea and people who don't like the idea. So once all those comments come in, the steering committee reviews them and decides if there's any new information that they should consider. If they think at that point that the proposal meets the criteria for a new relational problem, and then, you know, as I've told you, there are a series of criteria that we're supposed to be meeting, and I try to explain some of them here, that they then send it up the chain of command to the leadership of the American Psychiatric Association. And specifically, it goes to the APA Assembly, which is kind of like the Congress of the APA, and they discuss it and vote on whether or not they think there should be a new diagnosis in that chapter called Other Conditions. And then also, the final step, it goes to the APA Board of Trustees. So it has to pass both of those, a vote in both of those bodies for it to be considered and accepted as a new diagnosis. So this is a lot of information, and there's a lot of steps involved in this DSM-5 TR review process. And hopefully there'll be some dialogue back and forth that if the committee, the steering committee or the review committee want more information, hopefully they'll be in touch. We can provide that information, and hopefully there'll be dialogue from the people watching this webinar when it comes time for public comment, that you will tell the DSM-5 committee what you think. So finally, just let me remind you that this is all being created by our organization called the Parental Alienation Study Group. PASG is the organization that is basically promoting and sponsoring this proposal for the DSM-5. And of course, if you're interested in learning more about parental alienation, or you want to stay in touch, you can join the Parental Alienation Study Group. You just come to our website, which is www.pasg.info. And once you're there, there's a button that says Contact Us, and you can indicate your interest in the organization. So thank you very much for your attention today. I hope you have a better idea of the proposal. As I said, if you want to download the actual proposal, you can go to the website for that, which is www.parp-dsm.info. So yeah, I welcome you to come to both of those websites for more information. Thank you very much, and I hope you have a good day. Goodbye.